According to the Massachusetts Department of Mental Health, 7 to 10% of all police calls nationwide involve someone with a mental health issue. Some local police departments in the Commonwealth report percentages twice as high as the national average. In order to help them handle mental health and substance use crisis calls in a better way, Massachusetts provides training programs and resources to local law enforcement. Municipal producer Yu Xiaowen talked to the Needham Police Department to find out more about the training.
Deputy Chief Chris Baker was one of the earliest officers who attended the state-sponsored crisis intervention training, a 5-day, 40-hour program designed to give police officers improved recognition, communication, and de-escalation techniques when dealing with people who have a mental illness and other vulnerable populations.
Prior to training, I thought I'd just bring them to the hospital and they fix the person. That's not always the case. They need a lot of support and services in place, usually, to begin that process of not going into crisis.
Baker said the training not only helps them understand the individual's behavior, but also offers a broad view of the whole mental health care system and ways to access resources.
Knowing how to navigate the mental health field, learning about protective orders and what the process is when someone's brought in on a protective order, what evaluations are done or not done, when they can be held for how long, how to help family members.
The program also includes simulation exercises.
We'll walk around Brookline with tapes going through of people that are just kind of like, it's simulating people hearing voices. So we're supposed to be hearing these voices as we walk around and then kind of interact with people, store owners and stuff like that, to get the realization of what some people go through and how difficult it may be for them to reside in a community and be productive with them hearing voices.
According to Baker, Needham has been continuously sending officers to the training. Currently, all officers have acquired mental health first aid training, and 50% have obtained crisis intervention training.
Whenever they offer the class, they offer us 2 seats and we send 2 people. So we haven't ever said no. So we've kind of they give us 2 seats because space is limited. A lot of police departments in the area find great value in the training. So we're kind of slowly but steady training our staff.
David Forte is also a crisis intervention trained officer who has served in Needham for over 15 years. In early 2020, he became Needham's first community outreach officer. The goal of this position is to respond to anyone with behavioral health issues more effectively.
The old school of policing was get in, take care of what you need to take care of, and get out. We're a lot more time-oriented in the offices when they do respond, but again, they can't be there for hours, in one call. So again, my role is, again, to come kind of be in there and give them the time that they need.
Forte is able to spend a great deal of time providing follow-up services and directing individuals and families to appropriate resources. He said having trained officers respond to crisis situations facilitates his work.
I think it's really important that the officers that are the frontline guys and girls that are going to these calls have the training, because it's the initial interaction that they're going to have with somebody that's really going to set the model, really. Because if somebody has a bad experience with an officer, they're going to be really reluctant to kind of reach out to me, or for me to even call them, and say, hey, the guys in the street and the girls in the street that go to the homes are able to de-escalate a situation and recognize that there's something more going on than just maybe an argument that's going on with a sibling or a parent or whatever it may be, and to recognize that there's some other issue going on and to address it.
We feel it's important enough that our policy says that a crisis intervention officer should be sent on every mental health call if they're available. So we feel like the training is that solid.
The department also works closely with other local agencies, including the Public Health Department, Youth and Family Services, and the Council on Aging, whose social workers and nurses can respond as well to non-dangerous urgent situations and provide referrals. For the Needham Channel News, I'm Yu Xiaowen.